And we're joined this morning by Floyd Medical Center CEO Kirk Stuenkel and Environmental Safety Officer and Emergency Preparedness Coordinator Ben Rigas. Good morning, gentlemen.
Good morning.
It has been a very trying week and a half, I guess, just to be, stay safe. A lot of things happening, a lot of things going on with an unknown. And first of all, kind of like to get an update on the patient currently being treated at Floyd Medical Center for COVID-19.
Well, Tony, you mentioned it's been a trying week, but we've been drilling and getting prepared for this. I mean, what's been trying has just been the pace of events as they have unfolded. And you asked about the current patient. She's still with us. She's in our infectious disease unit that we put in place several years ago in response to the Ebola virus. So we're glad that we had planned for that and have that resource available to us. She's still with us, and we're taking care of her. We really can't give details about her condition, but she still is a patient with us under our care.
I think a lot of people don't really understand, or they forget that there are certain things that you can release about an individual regardless of what the case is. I mean, if you were trying to do this with everybody that's admitted to the hospital with influenza, which can be, someone can die from influenza just as they do from or could from COVID-19, you would just be going, all the time. So, but this is different because there's an unknown. And the employees, you also had some healthcare providers too that had to do some self-quarantine. How are they doing right now, and kind of give us an overall status of that?
Well, before we get into that, I would like to say another word about our current patient. Online and social media, some people have revealed more information about this patient than we normally do. So a lot of that information that's out there did not originate from us. HIPAA is still in place, and we are following those guidelines. Public health has different guidelines, and they may release certain information about patients. So any information that's out there, in addition to what I just said, didn't come from us. It came from other sources. Now, you asked about our employees. We have 20 employees that are on voluntary self-quarantine, and they are self-monitoring. And we actually had a couple of the employees that did get sick. And this is pretty instructive. And we did testing on these two employees, and it came back negative. So the reason I say it's instructive is that people are still going to get sick in this flu season, and they may not get the COVID-19. So these two employees got sick from something else, and the testing has revealed that they don't have it.
I was going over some stats this weekend about influenza cases in the area, and provided by the Department of Public Health. And of course, this area includes not only Floyd County, but it's like the entire region for this area. And if you go back just to December, in the beginning of the flu season in September, I mean, it is astonishing how many people from influenza have been infected. And it's kind of the same thing, keep your distance from an individual. We'll talk a little bit more in a moment about how to help, prevention. But let's go through, I guess, and dispel a misunderstanding, some misinformation that is out there about the timeline of this individual. So there was no test on a Saturday when this young lady showed up at the emergency room. And why is that? What criteria was being used?
Right. Well, when you say Saturday, it's a week ago Saturday.
Yeah, a week ago Saturday, not this last Saturday.
8-9 days ago.
Yes.
And at that time, there was a shortage of test kits available nationwide, so that they just were not available.
Right.
And when the patient presented herself to our emergency department, we used the instructions that we had at the time, which was the travel questionnaire. And so we'd had that in place for how long, Ben?
Years. Probably.
The travel questionnaire, though, I mean.
Oh, we've had that in place for several weeks now.
Right.
2 to 3 weeks. But we've asked the travel question for other infectious disease for years. So.
Right. So we used that travel questionnaire, and she hadn't been to any of those locations. And according to that, we traded her and released her. Mm-hmm. And so then she showed up again on Tuesday, the following Tuesday, with worsening symptoms. Of course, the same travel questions were asked, and she hadn't been to any of those locations. And public health said, "You're good." And our physicians felt, we're concerned. As they did a chest CT, and our radiologists are current on what's being talked about with coronavirus and COVID-19. They said, this we should be concerned here. This looks like what we've been reading about. And so we consulted with Dr. Gary Vocio, who's our district health director, and we decided to admit her to our infectious disease unit pending further testing and further investigation. And as the days went by from Tuesday all the way till Thursday night, Dr. Vocio was imploring the state to let us test her. And finally, we got permission. We got the results on Thursday night about 8 p.m. And so media kept asking us, we've heard you got a patient down here, and social media was active about that. Do you have a patient that has coronavirus? Well, no, we had no confirmation at that point. And so until we had some level of confirmation, and that was Thursday night at 8 p.m., we got a preliminary positive result. And then I had to ask, what the heck is a preliminary positive result? And they said, well, it's got to be confirmed by CDC, and that's going to come sometime later. Oh, and by the way, you need to think about those employees that got exposed on Saturday and on Tuesday until you put your patient in the infectious disease unit. And so that was it. That's the instruction we got. And we didn't get any instruction about informing the public. We didn't get any instruction about anything else. So our team, our response team, and we have a group that gets together, a command center, if you will, that gets together. And when we have events such as this, we met, we discussed into actually the wee hours of the morning, Thursday night, Friday morning, what's our response going to be? Well, we got to identify these employees. We got to get the supervisors to call them. What are we going to tell them? What are we going to tell the public? And we made the decision that the public needed to know. And so, there are some folks who are saying, well, why wasn't the public informed? We were going down the timeline and with the instruction, working in concert and cooperation with public health. And this is an incredibly fluid situation that continues to change up to today. But we've been responsive and responsible in dealing with this. And again, I want to emphasize there was no instruction on how to do this except you need to notify your employees. Well, what about notifying the public? What about notifying everybody else in the hospital? And we made those decisions to do that.
Hospital limited on the type of information it can send out due to HIPAA laws.
All right.
But it looks like social media, the armchair quarterbacks, and all of a sudden all these infectious disease experts now on social media have just really exploded this entire event. And maybe it's the unknown. Maybe it's that we need to know where this person is, what neighborhood they live in. You can't give that information out. And so communication is limited by law for the protection of the patient.
Well, that's right, Tony, especially for hospitals and healthcare providers. Now, public health is a different matter, and the information that's out there about this patient really came from public health. And public health, it's their job really to go back and try to put together who and when other people might have come in contact with certain individuals. And public health does that, times 1,000, with everything that's going on in the state of Georgia, with the Georgia Department of Public Health, but all over the nation. The epidemiologists, that's a big word, but these are people that study disease and disease patterns. That's part of what they do. A big part of what they do. They try to see who are the folks that got in contact with the patient and what needs to be done with that.
And as they're investigating, I guess they would contact all the individuals that possibly say, all right, you were with this person, you probably need to get quarantined and then we need to test you. And now, let's talk about the test for a little bit, because this has kind of been a question. Now, why can't I walk into a doctor's office or walk to the hospital, go to the hospital and say, I want to be tested for COVID-19, I don't feel good?
That's a great question. And as of last Tuesday, when this patient presented, there was just very little availability of this test. It just wasn't available, and you had to ask permission. And the state and the CDC was very carefully managing their supply of this test. That's why it took us so long here with our patient. And you can just imagine that all over the state of Georgia and the nation, there were folks in similar circumstances. And the health officials and CDC was trying to figure out, what are the circumstances under which we hand out these limited tests. Now, as of this last Saturday, like day before yesterday, it became more available. Ben, why don't you talk a little bit about that?
Right. So like Kurt said, it's been a fluid situation. So initially the test, there wasn't a lot of those, and they're being manufactured, and you had to be instructed by public health and CDC for us to get one of those done. Then it moved to where you can request that test. The physician can request that test, and then as late as Saturday, like Kurt mentioned, now we're able to send these tests to LabCorp and Quest, commercial lab, to get these tested. So the hope is that there's going to be a lot more available, that it's going to be a lot faster turnaround time, and that the more people that come in that we need to test, like other hospitals around, we'll be able to do that much quicker.
Well, right now, I guess, like you said, the test is going, or they're going to commercial labs right now. Like if you were to go to your doctor and get a blood test for that, they send that to another lab. It's not done there. It's not done at the hospital, but it's done at a bio lab where they do the test and can come up with what the results are and then send it off. Now, this is also something that has to be confirmed by the CDC because there have been some false positives that have come up in the area. And so I guess that's the reason why you kind of have the double testing or the double confirmation for this, because of the case of the nature of the illness, right?
That's what we understand.
Yeah.
When they had to do the confirmatory test, the Department of Public Health opened up their lab, and we're doing pre-screening on these tests, and that's how we got the first presumptive positive test. And so now with the commercial labs, if they do get confirmed as a positive test, the public health will then notify the CDC of those test results, and then they will continue following those patients along with anybody they've come in contact with along the way. So.
Right now, there are 3 cases at Redmond right now that are they're waiting for the results on that. This afternoon at 4, Tim Harrington is going to be briefing the City Commission on the county-wide preparedness for dealing with COVID-19. And we're just about out of time here, but for this segment, we're going to be back with more because I want to talk about what we can do for ourselves for preparation and also to help prevent the spread of this, and it's kind of like with regular influenza, staying a distance between somebody that might be sick or just good hygiene. And I mean, that you can only do so much, but at least every little bit of prevention is very necessary. One of the big questions we had, and we kind of touched on this in a moment, but want to emphasize why people cannot just walk into the hospital and say, test me for COVID-19. And there's a reason for that. One is, I guess, is being handled by labs, but also it's just a test that doctors got to order, and you have to have various symptoms in order to get this test for whatever reason that public health decides.
Right. Well, our laboratory, like any hospital our size, is a sophisticated operation, and we do lots of different lab tests, chemistry tests, blood tests, microbiology tests. I mean, we got lots of people in the lab and lots of tests, but there are some tests that we have to send out that we don't do in our lab, very specialized tests. And this COVID-19 coronavirus test is a brand new test, and so we don't have that capability of running that test in our laboratory. We have to rely upon the actual providers of this brand new technology. And so last week with our first patient that we had that we admitted last Tuesday, we don't have the capability of running that test. We had to ask to get that test done of the lab that had it, and that was Public Health and CDC. Now, as of 2 days ago, this last Saturday, now there are 2 commercial labs that have it, but they had to be authorized to do it, and it was an approval process by the federal government, and now they're authorized, so there's more availability. And so if we have patients that present now, and we are having patients that present now, we've got greater availability.
All right, let's talk about Floyd Medical. First of all, being able to handle infectious diseases. Now, this is not a brand new thing to have to handle infectious diseases. You've got a whole wing or a floor or rooms that are specifically constructed for that. And Ben, explain to a little bit of just how sophisticated this area of the hospital is.
Sure. So us here at Floyd, we are a region coordinating hospital. And so what that means is for the Region C area, the 8 surrounding counties around here, we help develop emergency plans, plan for pandemics like this could be. We are always training, exercising this. We've done this for many years, so this is not something new to Floyd. We take care of sicker patients every day at the hospital. We were designated a Tier 2 facility in infectious disease, so we were able to take care of these patients really well. We have a dedicated infectious disease unit at the hospital, and what that means is basically that room is a negative pressure isolation room. None of that air is recirculated throughout the hospital. It is exhausted outside and is very safe. We have a lot of good technology that we've brought in there throughout the years, and it's more than equipped to take care of this type of patient.
So when you're in an isolation room, like you just said, that air is filtered and recirculated within that room, not to other parts of the hospital. Did I understand it right?
It's not recirculated, it's filtered out.
It's filtered out
Through HEPA filters to make sure that air is cleaned before it exits the building.
And it exits the building. It's outside of the normal ventilation system of the hospital.
After it goes through filters and whatever else is required of that. So if you just go to the hospital, the reason why I ask, you go to the hospital and you're visiting someone in the maternity or whatever, you don't have to worry about breathing air that's come through a isolation.
That's correct.
Gotcha.
Yeah, go ahead.
We have 20 other negative pressure rooms throughout the hospital that we would utilize for this as well. So if anybody that we suspect to have this or any other infectious disease that requires a negative pressure room, we would put them in one of those 20 rooms plus our infectious disease unit if necessary.
And you made a good point. I mean, other people going to visit folks, and now we're under some restrictions, but if a person is pregnant and they're coming to deliver at our hospital, they can feel safe because we have isolated this one patient that we have and any other future patients that we've got. We're going to put them in these negative pressure rooms so people can feel safe coming and getting normal care in our emergency department, in our maternity wing, and throughout the rest of the hospital. And as a matter of fact, just planning for the future, and we hope it doesn't happen. I mean, Ben mentioned we have our infectious disease unit, and that really we have one patient in there now. We don't have capacity for much more than that, but we've got the other 20 patient rooms that have negative pressure, and we are preparing a whole floor in the Kindred building. You know, Kindred announced that they were closing several weeks ago, and now we've gotten the ability to take the third floor, and our plant facilities department is working to make all of those rooms negative pressure, so we'll be ready if we need it.
Right, and like Kurt said, we've planned for this for years, and in the recent weeks we've planned for this COVID-19 virus, and so we were able to secure a lot of equipment that we needed to where we can turn those rooms in the Kindred Build 2 negative pressure rooms if needed. So it's
kind of walk me through a process, if you would, and our listeners too, that if someone were to contact the hospital and say, or they're brought in by emergency crews. Now, let's talk about how they're prepared. The EMTs that respond to a call and understand, I guess from the press conference the other day, that they've got a protocol that they go through and are prepared should they come in contact, possibly be in contact with the patient. What is that process like? How does that from start to finish?
Right, that is correct. And Floyd EMS has done a really good job. When we got designated Tier 2 infectious disease hospital, they went through specialized training throughout the state, and they are the lead provider in EMS when it comes to transporting infectious disease patients. So they're trained on this. The CDC and Public Health has put out some guidelines for first responders, and that's what they're following. I would like to mention, though, like you said, if patients are wanting to come to the hospital or calling for a ambulance, things like that, they need to notify them ahead of time. That way we can be prepared when we get there. But those patients are transported to the hospital with the correct precautions, and then as soon as they arrive at the hospital, they are put into those isolation rooms if that occurs.
So our team has been thinking through, how might patients present themselves? They might call 911, they might just show up in the emergency room, they might come to urgent care, and so we've been thinking through each step of the way as to how patients might come so that we can be ready, so that we don't have the circumstance that we had a week ago where somebody shows up and then we learn later. And so that's very important. And if individuals, when they're feeling sick, I mean, they could help us by making that phone call that Ben referred to earlier. Gee, I'm not feeling quite good. I think I'm showing some of these signs and symptoms. Then we can be doubly sure we're ready. One other thing I want to mention about our technology. Years ago, we invested in some technology that's where we put a unit in a room that a patient's been in, whatever their infectious disease might have been. They might have had MRSA or something like that, and it's an ultraviolet emanating machine. You plug it in, and these ultraviolet light bulbs, if you will, fluorescent type light bulbs, they put ultraviolet light all over the room, which kills these pathogens. And so that's what we use. It's called TrueD. And that's the name of the equipment. We roll it into a room where a patient's been. We plug it in for the prescribed amount of time, and it helps sanitize the room.
Very good. All right, good information to know.
And another thing, speaking of the first responders, several weeks ago, we implemented through the 911 center to begin asking these travel questions that the CDC and public health is putting out there, so that anytime somebody is calling 911, that center should be asking those travel questions and getting that information ahead of time prior to law enforcement, fire, EMS responding to the scene.
All right. Kurt, you mentioned this is a fluid situation, guys. This is constantly changing. But the one thing that won't change is how individuals can really do a little self-prevention. And Ben, what are some things seriously that individuals can do to really minimize their chance of catching any kind of infectious disease?
Right. I think the biggest thing is just proper hand hygiene. You need to wash your hands frequently. You need to make sure that if you are sick, that you are staying home, and proper just social distancing. Make sure you're staying within that 6 feet, away from that 6 feet radius there, and just be just like you would with flu. Just with the flu virus. Make sure that you're washing your hands and taking care of yourself, eating healthy, and doing those things, and that'll go a long way.
For doctors and other healthcare professionals that come in contact with people with the flu, I mean, how similar are the symptoms or the patient's appearance from influenza and possibly COVID-19? Or is there any similarity at all?
I think there's some similarity there, and that's what's making things difficult, I think, across America to figure out what exactly it is at the initial start. But there are some tests that physicians are looking at to be able to pinpoint this a little bit easier. And I think as time goes on, we'll be able to discuss those, and I think those will be more prevalent as time goes on.
Now, with the CDC and the I guess getting these test kits out to labs probably in a more rapid pace now, because this is the first case that the individual had not traveled to China or South Korea or Iran or Italy or any of those places, but from Washington, D.C.
Right.
And so what would have happened had Dr. Valanches not insisted on further testing of this patient?
Well, this is probably the first case that we know about on the East Coast, out in Washington State. Those nursing home patients obviously hadn't traveled anywhere.
Right.
But here on the East Coast, this is probably the first one that we know about where we had a patient show up, hadn't traveled anywhere, and then, due to just how sharp our clinicians are, they said, we're not going to release this patient. We're going to admit her to this infectious disease unit. And it was actually the radiologist that caught this. They ran a chest CT the second time she came to us when she was sicker on last Tuesday. And they said, this looks like what we're reading about. We need to be cautious. And we're just so grateful that our radiologist, Rome Radiology, and I've got to go back and identify who this radiologist is, but Rome Radiologist said, staying current, said, let's be cautious here. And our team, and I was part of that conversation too, it was amazing. Our team, in collaboration with Dr. Valanches and also with Dr. Gary Voscio, let's be cautious. Let's be cautious. And if we hadn't been cautious, we might have admitted that patient to our general patient population. And so we were really fortunate that our clinicians are on the ball, and they were 100% correct.
Well, and I think there are a lot of hospitals that are now having to really take a second look at individuals, and just, safety is, better to err on the side of caution than,
Right.
But that can be a tough call sometimes, and you don't want to necessarily do anything unnecessary. But in a situation like this, I guess it's like, look, I'm not, forget that. We need to really.
Well, I hope our experience, and we were fortunate because we had smart guys involved,
Right.
and I use guys in a generic sense. We had smart folks involved, and maybe this has been instructive for other people. As other organizations are going, yeah, we got to be cautious too now. It's not just the travel questionnaire. We've got to look at signs and symptoms, and we got to be more careful.
Well, the clock's caught us here, but gentlemen, thank you for joining us. Stuenkel and Ben Rigas. Appreciate you guys being with us today.